diabetes, people think, well, it's just blood sugar and it may affect the eyesight or neuropathy. Oh no, it can have a lot of effects on urology function. And so one of the things I'm going to talk about is erectile dysfunction. You say, how does diabetes affect erectile dysfunction? Well, the ability to get an erection is a vascular event, and if you have problems with blood vessel disease, you don't get the blood flow and you don't get the erection, okay? Another thing that diabetes can affect is testosterone. You know, it's a syndrome, it's called metabolic syndrome, but you know, generally diabetes, it also exists in the presence of excess body weight, and that can have lots of effects on endocrine system, including lowering your testosterone level. So obviously I'm talking about guys right now, but so we'll talk about that. The next big subject we'll talk about is urinary function. You know, how does diabetes affect the bladder? Well, you know, the bladder is a muscle, right? And muscles are controlled by nerves. And we know that poorly controlled diabetes can affect the nerves, right? You've heard of peripheral neuropathy, but it can also affect your bladder too, insofar as the bladder itself is controlled by nerves. And that has implications both for men and women, okay? In terms of bladders that don't work or don't work well. And that is why I'm going to discuss incontinence in women, the various types of incontinence and the treatment, and then also with men, you know, in the context of BPH or benign prostatic hypertrophy. So, you know, we're going to go through a lot of material, but it's it's an intimate group. So if you have any questions, you know, don't you feel shy, just you know, blurt it out, and we'll get through all the material. But you know, the goal, the objective is at the end of this, you'll have, you know, a better understanding of how diabetes can affect your urology functions. Okay. So, you know, so what is erectile dysfunction? Normal erectile function occurs for stimulation, okay? And stimulation causes blood to go into the penis where it gets trapped, okay? The outflow, as you get the erection, the emissary veins that provide outflow get closed off, and that's how you achieve a rigid erection. As the chambers rapidly fill with blood, they expand and the penis becomes firm and elongated. The result is an erection. So again, it's a vascular event. Okay. Can everybody see this slide okay? Everybody see it? Okay. You know, what causes erectile dysfunction? It can be caused by, you know, injury, brain or spinal cord injury, a disease, i.e. diabetes, an operation, prostate gland removal. You know, if you've had radiation for prostate cancer or surgery for prostate cancer, that can cause erectile dysfunction as well. Substance use, tobacco, alcohol, drugs, you know, other medications like blood pressure medications can cause it. So it's very common and it's very treatable. The other idea here, and perhaps one of the most important ones, is, you know, that you know, a man's penis and the function of the penis is actually a marker of his cardiac health. All right, and you say, well, how could that be? Well, I mean, people understand atherosclerosis, right? Is hardening of the arteries, and you understand that in the context of a heart attack, right? You get hardening of the arteries, you get atherosclerosis. It reduces blood flow. Hey, come on in. There's some seats right up front here. Don't be shy. We'll just wait a minute while you come. We just got started. Here, we got a seat up here, right up here. Yeah. Oh, you got it. Okay. Oh, we'll keep going. So, but you know, people have heard of atherosclerosis insofar as you get coronary artery disease. But if you think about it, you know, the atherosclerosis doesn't just affect the arteries of the heart, right? It affects all the blood vessels, and the penile artery is more narrow in diameter than the coronary artery. So logically, you would expect that the smaller diameter arteries will be occluded before the larger diameter. And in fact, you know, if they look at people that have had a heart attack, they've noticed that that many times these men have had erectile dysfunction that predates it by about 5 years. So if you have a new onset of erectile dysfunction, it's important for you to see a cardiologist or your primary care physician, get your heart checked. okay, because that could be an indicator of heart problems. So, erectile dysfunction has shared risk factors with cardiovascular disease, with depression. So a person's lifestyle, medication use, psychosocial factors like depression, anxiety, health status overall, all these factors play a role into normal sexual function, okay? So if you look at it, of all these other conditions associated with erectile dysfunction, diabetes increases the likelihood of ED the most. If you're a man, you got diabetes, you're 4 times as likely to have erectile dysfunction. All right. You look at prostate disease about 3 times, peripheral vascular disease about 3 times, cardiac's only 2 times. Lipid problems or high blood pressure 1.5 times. I mean that's really significant. That's why I'm here giving the talk so people understand. What are the treatment options for erectile dysfunction? So I can tell you in 2019, one way or the other, we can have a treatment that will treat your erectile dysfunction. Okay, there's absolutely no question about it. The question is, what treatment is right for you, and what are the different options? So most people have heard of the pills like Viagra, Levitra, Cialis. Okay, generally they're fairly effective to start out with. They're easy to use. It's important to understand they all have the same mechanism of action, that they act on an enzyme that promotes nitric oxide to open up the blood vessels. Okay, so switching from one medicine to the other is not likely to be more effective, right? They have the same mechanism, so if you fail the highest dose of one medication for ED, switching to a different medication isn't likely to be effective. So what's the point of having the different medications? Well, they have different side effects, okay? Viagra, for instance, can cause blue vision. Cialis can cause muscle cramps. So if they're effective and you're having side effects, we can switch to a different medication. So there's medical therapies. There are penile injections, which is an injection of medicine that you administer yourself into the penis. It's the same type of needle and syringe that you'd use if you inject insulin. Okay, so very, very tiny needle, but you inject the medicine directly into the penis, and it is a mixture of different chemicals that cause dilation of the blood vessels, and it's called trimix. It's called trimix because it's a mixture of 3 different medications, okay? Generally, once you put the injection in, you get the erection within 10 minutes or so. It's generally very well tolerated. Unlike the oral medications, which can have side effects, this one, generally the only side effects are discomfort or scarring of the penis that would cause it to bend in one direction or the other, but the likelihood of those happening is pretty low. And in terms of cost of the penile injection, they are pretty much, I'd say, on par or a little less expensive than the oral medications. Another category of treatment for erectile dysfunction is a vacuum pump. Vacuum pump is just like what you'd imagine. It's a cylinder you place over the penis, you create the vacuum. That vacuum brings blood flow into the penis, and then you put a little ring at the base of the penis to hold the erection in place, okay? The issue generally with a vacuum pump is the erection may not feel normal. It may feel cooler temperature-wise than an erection. And then the final option, which, like I said, we can fix anybody that has erectile dysfunction. The final option is a surgical option, which is a penile implant that's placed surgically. So with that overview, I want to go through each one in a little bit more detail. This is an example of a vacuum erection device. Okay, it's battery operated, and here are the different rings that you put over the base of it. This is medical grade equipment. Okay, so this is not something you'd find at a novelty store. Probably costed $200 to $300. You could use it pretty much as you need to use it. It's probably the most cost-effective approach for treating erectile dysfunction. Here is an example of the pills. Viagra, the blue pill. For these to work, you have to be in the mood. So just if you take a pill, and you watch C-SPAN, nothing's going to happen, right? right? So you have to be in the mood for the pills to work. A lot of times they will cause some side effects like headache, facial flushing, upset stomach. Rarely can you have vision or hearing loss, but those have been reported with these medications. Again, the Cialis, the side effect could be muscle cramps. Viagra, you can have blue vision. They have different durations of action. So Cialis, you can either take it daily, and it's FDA approved for both BPH, urinary symptoms, and erectile dysfunction, or you can take it as needed at a higher dose. The Viagra and Levitra, generally their effects last for about 8 hours. Drug, here's an example of what the injection therapy looks like. See the needle self-injecting into the lateral aspect of the penis here, into the corporal bodies. Generally, why would you choose this over pills? Well, it gets to the point where the pills don't work anymore. Or, what's really frustrating is the pills work 60% of the time, right? Maybe a little bit better than flipping a coin, but that in itself could be problematic. If you have erectile dysfunction and you're thinking that this event is going to be successful, but it's not, and it's only worked 60% of the time, it can create anxiety and then performance anxiety and other issues. So, when the medicines kind of stop working is when you want to move to a different treatment option. And this is a really good option. The concept of injecting, one's penis doesn't sound very enticing or romantic, but the fact is, people don't really feel it, and it's not that big of a deal, and generally it's a lot more reliable than the oral medications. But at some point it too doesn't work. Okay. Here's another one, just for the sake of completeness. It's a transurethral system where the medicine is actually put in through the urethra. It's called Muse. We don't use it that much, but in case you've heard of it. Now, the other category of erectile dysfunction treatments include penile implants. Okay, so the way these are performed are surgically in the operating room. An incision is made area, very small incision, and we implant either malleable rods